We get $50 for the first year of the buy-in, $50 for the current year, and I'm proposing 50 more for the next. So we're starting to reverse that. Now that's basically first grade to 12th grade. That's the existing funding. We're one of relatively few states that does not provide state funding for all-day kindergarten. Optional, parents' discretion, but optional. And there are the states that are way below us in terms of people's incomes, and therefore state resources who are providing that state support. And the experts say that for most children, all-day kindergarten is going to really be beneficial. And then going back even earlier, the experts say that early childhood education, beginning 6 months or whatever, combined with some support from parents, makes a big difference in children's readiness for kindergarten and beyond. So my proposal is to fund a big expansion, and hopefully the next biennium we'll have the resources, full support for optional all-day kindergarten, and then scholarships for parents to take to early childhood learning facilities, and again, at their own discretion, their own choice, but to provide the avenue where any child, no matter what the circumstances of his or her birth, can achieve the American dream.
Got Dennis from Zim.
I wish I had a 6-year-old again. I envy you. I got my first grandson next Wednesday at noon. That's what I'm told anyway.
I just want to thank you for both your efforts to pursue fairness in taxation and the efforts to invest in Minnesota. You're taking on a heck of a difficult job after terrible neglect by previous administrations. So thank you.
Well, thank you very much. It's a great job. I signed up for difficult, and I have no complaints. And thank you. It's my honor to serve.
Governor, I have Lori from Duluth right here.
Thank you, Governor, for being here today, and I want to thank you for a couple of weeks ago when you spoke at the Capitol representing individuals with disabilities. I work at UNAC here in Duluth. We've been around for over 40 years. We serve adults with disabilities in vocational as well as life enrichment services. And what we'd like to ask you to do is to please support a COLA, a cost of living adjustment, so we can give our staff a raise. It's been over 40 years. And we'd also like to please ask you to restore the 1.67% decrease that could come our way come July. It would really hurt us pretty bad across the state. So I want to thank you for listening, thank you for being here and supporting people with disabilities.
Well, thank you for your very dedicated work. And I was thinking of nursing homes for people who are working full-time doing that kind of compassionate and really needed work for poverty wages and no benefits because people can't afford to pay them better is really a travesty. I support restoring the 1.67% cut, and it's in my supplemental budget, and I'm doing everything I can to get that put through. The COLA increases, I believe, are part of my budget, or at least in some fashion. No, they're not. Okay, well then, where's Sarah? Okay, write it down. I'll get. You give a phone number. This is Sarah. That's Sarah. Put your hand up, Sarah. That's Sarah. Sarah Hyde from Montevideo. Off and on for 8 years. She put up with me. Dana holds the course record. She's put up with me for 13 years. But if you would give her your phone number, I'll ask Commissioner Cindy Jessen, Commissioner of Human Services, to give you a call. And if we're missing something, this is why I have these kind of occasions, is to find out.
Got Tony from Duluth.
Hi, Governor. Thanks for coming up here and giving us this opportunity. I serve on the board of directors for the Minnesota Restaurant Association, and I'm also a manager for Grandma's Restaurant Company, which is located here in Duluth. We employ about 600 people here and in Virginia. I want to thank you for your support of increased funding for Explore Minnesota tourism, and also supporting post-Labor Day school start. Those two initiatives will really help us to continue to do.
Local school district option, choice, right?
But what I want to ask you was just what your thoughts are on minimum wage legislation.
Well, overall, I support it with all respect to you and the gentleman who spoke earlier, because I believe that we want to incentivize people to work their way out of poverty, and that, ideally a minimum wage, and it would be still below this, but it should be at a level where somebody working full-time can make enough money to keep a family of 4 at the poverty level, and then with more training, more experience, move forward and achieve middle-class status, and again, earn their way to the American dream. The other side of it, in addition to not incentivizing people working to the same extent if we underpay them, if somebody underpays somebody below the minimum wage, The rest of us pay for that difference. You know, they get earned income tax credits, federal government, they get food stamps, they get public medical assistance. So you're paying for everybody who's not getting paid a decent wage, whether you know it or not. Similar with healthcare, where people go uninsured to the emergency rooms and get much more expensive care. So that's, I think, a very important consideration as well. The tip credit thing is, you know, that's dicey, and I frankly let the legislature thrash that one around for a bit longer. I understand the concern of people who, you know, are effectively paying above the minimum, well above the minimum wage, and I also want to protect those. Some people get a lot in tips, some people get very little in tips. So it's like the Texas politician. Half my friends are for it, and half my friends are against it, and I always stick with my friends. So, figure that one out.
Thank you.
Thank you.
Governor, I have a question from Becky from Duluth.
Good evening, Governor. Thank you for being here tonight and taking our questions and listening to our concerns. I understand that today you signed off on the legislation establishing the health care insurance exchange here in Minnesota. I also understand that as that legislation was going through conference committee, there was an amendment that required elected officials to purchase their insurance through that exchange. I also understand that that amendment failed by the majority party voted against it. And I'm wondering, my question to you is, would you, so that amendment by it failing has exempted elected officials from purchasing insurance in that exchange? Right. My question to you is, since we, the taxpayers, pay your salary and your benefits, would you be purchasing your health insurance through that exchange like the rest of us have to?
Absolutely, I would. And you don't have to purchase your insurance at the exchange. If the exchange makes it beneficial for you to do so, plus that you will. But yes, I'm certainly, and I'm disappointed. I wasn't familiar with that amendment that you just mentioned, but I'm disappointed with that. I believe, again, we public officials hold ourselves to standards. I had an amendment when I was in the U.S. Senate when we passed the prescription drug coverage for seniors that no member of Congress would get better benefits than we're providing seniors through that legislation. And it passed the Senate actually, but then of course it got dropped in the conference committee. So I believe that on principle and be glad to do so and make a point of that.
Why would you sign a piece of legislation that leaves that out then?
Well, because there are compelling reasons to sign the legislation, in my view. I wasn't aware of that one, but I would still have signed it even. If I'd known about that while I was in conference committee, I would have weighed in and you know, done my best to change it. And we can, you know, come back next year and change it. You know, I mean, the Affordable Care Act is a federal law passed by Congress, signed by the President, ruled to be constitutional by the United States Supreme Court. So we have two options as the state of Minnesota. First, either we can develop our own healthcare exchange, taking the best wisdom of people all over Minnesota, which is what's been done over the last year and a half. We had task forces on every different aspect of it, working to put together the best system under the requirements of the federal law. Or we can just opt out of that and just accept whatever the federal government puts on all the states that don't develop their own exchanges. I have no doubt we're going to do it far better than the federal government can do it for everybody. And we're one of 4 states in the forefront of developing these, so along with Oregon, Washington State, and Maryland. And it's not going to be perfect at the start. It's a gargantuan task. It's envisioned that 1.2 million Minnesotans will choose to get insurance from it because they can get a better deal at a better price by the end of 2015. But you don't go from 0 to 1.2 million without some bumps. And so there will be some. But you know, it's going to have to be competitive in the marketplace, or for you or anyone else, except for me. I mean, I promise I'll buy it. But it's going to have to be competitive with what people can get elsewhere. It has to be better, and that's the requirement. So, but I'm sorry that occurred. I'll propose we remedy that next year.
Got Barb from Duluth.